where'd you get the little things for the lights?
What things?
The rags.
Yeah.
Looks like an old shirt.
It's probably my old shirt.
I had to wash it.
So do you like doing these podcasts? Do you enjoy it?
No, because I don't like working with James, but otherwise it'd be fun.
That I can understand. It's like an all-day affair.
I'm your host, Dr. Alexis Hazen. I'm a board-certified plastic surgeon who specializes in breast surgery and gender-affirming surgery and cosmetic surgery. I've been practicing in New York City for over 20 years and continue to learn and educate as an associate professor at NYU Langone. Please join me in our mission to discover Zen.
Oh yeah.
Get your hair going.
Yeah.
Get a little flip.
5, 4, 3.
Just as natural as could be.
Welcome to the Dr. Zen podcast. I'm so happy to have Corie Tappin, who is my sister, among other things. And on Dr. Radio, I really didn't want to promote that so much.
But now on camera,
But
we
now-
look identical.
yeah,
and
so
sort of
it's
have to. You can't
sound
not say
identical.
I'm your sister.
Right, exactly.
That'd be weird.
It would be weird. And in addition to being my sister, she's an acupuncturist. She is a board certified in traditional Chinese medicine and acupuncture from Yosan University, right? That's where you got your education. And then you are also the founder of Soul Space Malibu, and you practice Feng Shui, sound healing, medical Qigong. You prescribe herbal supplements. You are an expert in meditation, among other things.
And
right?
acupuncture.
And
Yep.
acupuncture, obviously. And I thought we'd just start out with, obviously I know this story, but how did you get interested in pursuing this? Because you had a whole career in film, well, really in video, right?
Yeah, the entertainment industry.
Yeah, the entertainment industry. Back when there were DVDs.
And
VHS. Oh, VHS, right.
I started in VHS.
That was the best.
Yep. So this is my second career. So I started out of college pretty much in the entertainment industry, what was called then. Now it sounds sort of racy.
Yeah.
But,
yeah, right. It sounds like porn.
Yeah. My first job was at CBS Fox Sports Marketing. And I worked with the group that brought sports tapes like NCAA March Madness and NBA videos and exercise videos out, and worked on Share Fitness and the Jacqueline Smith exercise videos and
Share Fitness.
Yep. One thing led to another.
That brings me back.
I got moved out to California and joined Fox Video and worked in the video there, and eventually we had DVD. This was long before streaming and long before podcasts, and really it was before the internet.
I remember when you launched Spinal Tap.
Yeah, Spinal Tap on DVD. It was a big deal.
A big deal.
Yep. And anyway, so
this one goes
worked
to 11.
in
right?
yes.
Spinal Tap. Yeah.
I worked in that industry for a long time, and retired in 2002 as Senior VP of Marketing at MGM Home Entertainment. And I had one child, and Bella, and I left to retire, I thought, and just have a fun life, but also to rejuvenate myself.
Because you were burnt out.
I was burned out, I was unhealthy and infertile.
Oh, wow.
And I had been trying to have a child for years and had been unable to. And I thought, well, if I just not working in a pressure cooker anymore and in a toxic environment, then I should be able to have a baby. Well, no. And so I embarked on this quest to heal myself. But I also had tried IVF, and that was unsuccessful. And at one point, the doctor said, we should leave this up to God, because I don't think you should keep doing. We don't know much about these drugs, and they could cause cancer, and you already have one healthy baby. Your eggs are very old. And he literally said those words.
Words you love to hear.
He literally said those words, your eggs are very old, and so I think you should just be happy with what you have and leave the rest up to God. And I was like, okay, thanks. But meanwhile, I had met this.
Since you're my sister, I'm going to fix your hair.
Thank you.
At Zen Essentials, our philosophy centers on inclusion and equality in our collective journey towards health and wellness. We invite our customers to embrace a skincare routine that goes beyond the surface, fostering a radiant connection between your skin and the nourishing elements we meticulously infuse into every product. Zen Essentials, because your health is essential.
Ryan the Farmer, Part 12.
But meanwhile, I had been introduced actually through the fertility doctor's practice to a woman who practiced what I do now, which is traditional Chinese medicine, acupuncture, and holistic medicine.
Totally forgot this.
And she said, work with me for 3 months. We're going to change your diet. We can heal you. And she said, cells rejuvenate and cells turn over, and there's no such thing as bad eggs in Chinese medicine.
There's only good eggs.
And well, eggs change, cells change, and we believe in rejuvenation. So work with me for 3 months, and I did. So I went and saw her weekly for acupuncture. She put me on a brew of herbal medicine formulas, and she also changed my diet, and she put me on something called the body ecology diet. And
Oh, wow, that's going way back.
not to go on to long detail,
Yeah,
but
yeah.
it changed the structure of my constitution in a way, where from going from a very acidic system,
Right, and
I had a more alkaline
inflammatory,
and
yeah.
more balanced system. And so 3 months later, I was pregnant with Billy, my son, who is 6'7" and a half, almost 6'8", the strongest child that anybody ever knew. And that's
I can
from,
vouch for that.
quote, old eggs.
Yeah.
So that opened my eyes to the power of this other kind of medicine and to doing simple things to change your body and change your DNA, really,
Yeah.
in a way.
Right.
I mean, I had had 9 miscarriages.
Jesus. And you'd gone through a couple cycles
and
of
I had a
IVF.
couple cycles of IVF and basically been told that
Yeah,
it
like-
was useless.
yeah.
And not only through this whole process, it wasn't just, opening my eyes to this, what I think is an amazing practice of
Yeah.
medicine, but I also, did a lot of spiritual healing as well. And met many, many great healers. So it just opened my eyes to all the things that are out there besides Western medicine, which I also subscribe to and think
Yeah.
is great. So that's how I started. Sorry, that's not how I started.
No.
That is what got me onto a path of health and opened my eyes to something that I then became passionate about. Never occurred to me that I should be doing this.
Right, right.
So then I had my baby, enjoyed myself, and lived a fun life.
How long? Now I can't even
About
remember.
5 years.
5 years. Okay.
And so then when my son was going into preschool, so actually only like 3 years, I got itchy to do something else. And I actually had a life-changing car accident.
That I
and,
remember.
walked away from a completely totaled car, and I thought I should be dead and I'm not. So why am I here? And that got into a quest of like, why am I here? And
Like, as in, like, what's my purpose?
what's
in
my
life?
purpose in life?
And you didn't feel like your purpose was to be a
My
retired
purpose, I didn't feel like my
person.
purpose in life was just to serve myself. And I also didn't feel like my purpose in life was to go back to marketing or business.
Right.
And
that
so I
was-
knew that it was
that ship
something
had
else.
sailed.
And so it just took a few sort of times meditating to realize, wait, you're passionate about something. Chinese medicine, holistic healing, spiritual well-being. Do that.
Yeah.
So I enrolled in school, went for 4 years, and here I am.
Wow. I remember you going back to school, and I remember your summers being studying and studying for your exams, and it was
boards.
the boards, and it was a really big deal, very
Yes.
serious school.
It is. It's hard. It's basically like
It's like medical school.
medical school for the first 4 years.
Yeah.
Then you did, endless training after that, which we don't do. We
Right.
can then be thrown out in the world to help people. But luckily, we're given tools to know red flags, so we can send people to people like you
Right.
if they need to go to an actual Western medical doctor. Yeah.
So that brings me to my next question, and we talk about this all the time, and it's a conversation we have around the dinner table, and we talk with our kids, and but from your point of view, what is sort of the basic difference between Eastern medicine and Western medicine, from your experience and your training?
Well,
And I know it's a huge question, and you could talk
Yeah.
about it for hours,
but I mean, I think the main thing is that Eastern medicine and practices focus on health and preventative medicine. So the idea is not to get sick. And there are sort of old sayings about like how the superior doctor has only healthy patients. And
in Eastern medicine.
Yes.
Oh, interesting.
yeah, and that
Because why would you go to the doctor if you're healthy?
right.
In Western medicine.
Right.
Right?
And-
you only go to the doctor when
and-
you're sick.
Right. And so the idea would be that you would prevent illness from ever occurring. And there's, old sayings about like that treating disease once it's manifested is like digging a well when you're already thirsty. And so that's an old Chinese saying.
Yeah.
So the idea
Behind
is
the eight
to
ball.
maintain balance and health, and so that you avoid disease, because we know we're going to get disease as we age. We know that that's a possibility. So the idea is to avoid it. And so treating, it's much harder to treat somebody when they're already sick.
Yeah.
It's much easier to keep your immunity up. If you could focus on, as a person,
Yeah.
think about you just trying to keep your own immunity up so that you don't get sick. You would much rather do that than not think about your immune system and then get the flu.
Yeah.
And then have to deal with that for 10 days or maybe 2 weeks, and then the post-viral syndrome, and be sick for basically a month. And maybe have a lingering cough for 3 weeks after that. Whereas you could focus on your immunity.
But
So this is one of the main
that's
things.
a big, big difference.
The other thing I think is how we look at patients. So first of all, we have a lot more time. A lot of acupuncturists don't take insurance, and most acupuncturists don't charge very much, but they also they don't make very much, and they're poor. But they have more time with people. I mean, typically an acupuncturist will allocate an hour,
Oh, yeah.
and they
Versus the 15 minutes with the
or
pediatrician.
five,
Yeah.
And acupuncturists typically don't use lab work to evaluate. So they evaluate on smell, tongue,
What do you
pulse,
mean? What do you mean? Tell
what a
me.
person smells like,
Oh,
looking at someone's tongue.
interesting.
If you think about it, it's the only organ that's actually visible.
The skin.
Skin, looking at the skin. Of course, that's
Yeah.
the largest organ.
Yeah.
Yeah. So, but that's one of the things,
Yeah,
to
yeah.
look at the skin, to evaluate vitality through the eyes, to evaluate how a person's overall energy looks, and what their chi, what is
Chi
their
is energy.
chi is basically their energy. What are they projecting? What sense do you get from talking to them? So pulse, tongue, all these other things. Some people smell differently. There's certain smells with diabetes
Yeah.
has a certain smell.
And with pulse, you would feel the pulse.
You can feel the yes,
And you would-
almost all. You're trained to feel
Yeah.
the pulse. I find I feel the pulse less and less because sometimes I just know already what a person
Just like
pulse might
walking
be
in the door.
kind of already, but I feel the pulse in complicated cases where I'm not sure exactly what's going on. But let's say a basketball player comes to me and he's like sprained something. I don't do a big tongue and pulse thing because they'll be like, what? You know what I mean? So
You're
you
like,
have
stick
to
out your tongue.
yeah,
You're like,
stick out your tongue. They're
I'm
like,
not, no, I'm not doing that.
Plus, I know their tongue's going to look good because most athletes have very healthy tongues. And you can catch a glimpse when someone's talking of what their tongue looks like usually. So it's less important. But the point is that a typical acupuncturist will evaluate what a person
Okay.
looks like, their whole body.
Right.
Which brings me to the second thing. What I practice, Eastern medicine, it's a holistic practice. It's really the whole person. And I think that's very different from Western in the sense that Western has so many specialties. And specialization is becoming more and more prevalent in Western medicine, I believe. There are more and more specialties.
Like I'm like
Where-
super specialized.
Right. And as you become more and more specialized in a certain area, you tend to not know as much about other things.
Sure.
Which is normal.
Right.
I mean, like I focus on pain and orthopedic injuries. So now if someone comes with, fertility, for example, maybe that isn't something I know as much about anymore. But I try to because people do come, especially because of my own story. Yeah. But the point is that we do tend to treat the whole person. And we believe that everything's related and connected. So, for example, I had a patient come who was having terrible digestive problems for 3 months. So, you do the normal intake, tell me about the digestion, when did it start, what's the manifestations, what are your symptoms? But then we try to figure out what are the root causes. Why is this person having these symptoms? Whereas Western medicine tends to treat the symptoms.
100%.
So they're going to give you a medicine to treat whatever that is that's happening to you. Whereas in my mind, I'm going back. What is the root? We call symptoms branch. This is like a tree. I want to treat the roots. So with this woman, and I have the time, I'm sitting there talking to her. What happened 3 months ago in your life? Did anything change in your life 3 months ago? Well, guess what? Her son got put in jail, and she had to take custody of his little child who was 2 years old. She was a grandmother.
Wow.
That's a big deal.
That's a huge deal.
Huge deal. Who could eat, right?
Right.
Who could eat? And I'm like, just being able to explain to her, of course, how could anyone eat after this? That's so upsetting. When you're under that kind of stress, you're not meant to be eating. Rest and digest, that's parasympathetic, right? Sympathetic system, if you're under a state of extreme stress, your sympathetic nervous system is designed to have you fight off whatever, the dragon that's chasing you, the lion,
fight or flight.
To run. The body's system shuts down, right?
The blood shunts to the heart and the lungs, doesn't go to the stomach, doesn't go to the extremities. It's like
exactly. You're explaining it perfectly.
Yeah.
Right? So the blood's in your heart so that you can run.
Yeah, and fight off the lion.
And do whatever you need to do to take care.
But you're not going to be eating meals.
And you're not meant to. So when someone's in a state of extreme stress like that, their digestive system goes kaput. So being able to explain this to her, she then had tools to try to help her stress. And then she came in once a week for acupuncture, which relieves stress. And that's the end of the digestive problem. She was fine.
I mean, it makes so much sense.
It does. And that's just a very simple story and an explanation of how this works in a way.
Yeah.
And how it's different, I think.
Yeah, absolutely. So, we were going to focus a little bit on just like basic techniques that you could take from, your kind of Eastern medicine and use in everyday life for regular folks to improve their health and well-being. A lot of people either know a little bit about it or know nothing about it, but there is a focus nowadays on health and well-being, and there is a little bit more of a focus on, people talk about, like if you look on TikTok and Instagram, everybody's talking about self-care. And that translates to a lot of different things. Some of them are really dumb, I think, no offense to, but some of them are really useful and helpful, and there is a lot more interest, I think, in being mindful and in meditation and in
Definitely.
breathing. And so, for our listeners, what would be some things that they could incorporate into kind of everyday life? I mean, things that I know you do and your family does.
Well, I mean, everything you're saying is right, and there's almost too much information out there, and everyone's sort of jumped on the wellness wagon now. And I personally get confused. I think it's so complicated, like all this biohacking and all these things that you're supposed to do, and having red light in your house after sunset.
Oh yeah, we talked about this.
I'm like, what?
And there's like, you're supposed to like turn off all the lights.
Yeah, and eating this and not eating that, and there's just a lot.
Yeah.
And I break it down to very simple stuff. And I mean, I have this little thing that I keep handy. This is from a long time ago, but it's sort of keep it simple, 8 ways to health. And these are basics.
Okay,
And
let's go through them.
so, people need to poop every day. I'm not kidding. Like,
No, I know you're not.
But
I
people
just-
need to poop every day. You'd be surprised. People come into the clinic and you're like, so tell me about your bowel movements. And they're like, oh, they're fine. They're normal. And if you pry, which we do, we
Right.
talk about poop a lot in Chinese medicine.
You and old people.
But-
Old people love talking about poop.
Yeah, well, that's, yes, But
And little kids.
But every 3 days, that's not normal. People should poop every day, and it should be formed. And I don't need to go into the detail now. But
Well, you could go into the
You should
detail.
have a hearty evacuation every day. Okay.
Remind me later, I'm going to
Okay.
tell you a poop story.
We've always thought people need to sleep. So these people that are out there saying they're existing on 3-4 hours a night and
I
they
am
can get all this
so
done.
sick
Sorry.
of that line.
And now finally, the Western guys and the scientists have caught up with all of this, and they're showing now that sleep is very protective against dementia.
Yeah.
So now everyone's going to be trying to sleep, which I'm relieved about. But we've always known that adults should have 7 to 8 hours of sleep a night. You need to rest, and children need like at least 12. And that goes against how schools are organized and homework and after school activities, but people need to sleep. It's critical.
There really is.
Now, this wasn't such a big deal in the olden days when these sort of laws were passed, but avoid toxins. And this now could be almost a number one. But there's so many toxins in our environment and things that you would think are okay.
No, this is my whole thing now. I mean, I've had some
Yes.
serious health issues
Yes.
around this.
But, things that are ubiquitous in our environment, you go to the grocery store, if it's on the shelf, one would think it would be okay, but it's actually not.
Right.
And so it's not just that, it's all of the toxins, the things that are sprayed on our food, the things that are sprayed. And you can only control what you can control, but you can control your own environment. You do not want to be spraying Roundup on your lawns. You don't want to be using any kind of toxic pesticides in your house. You want to make sure your water is filtered.